Well, good morning and welcome to Morning Cafe. It's always a pleasure to have you joining us. My name is Linda Alala, and it is time that we take you through the day, or we kickstart your day on a very good note, updating you on what is happening in the world of news, importantly entertaining you and enlightening you. Some bit of education today on the second lapse, or the second to last lapse, that is the 8 to 9 p.m. a.m. Sorry, that is the 8 to 9 a.m. segment, where we'll be taking you through some, bit of mind and mental games, or mind and mental, lessons, and we'll also be teaching you on how best you can ensure that you advertise your business online, because everyone is moving online, especially at this time of the pandemic where there are no movements, physical shops, no. So it's important that you learn how best you can go out there and sell your product, go out there and advertise your product, and still make a kill despite the fact that you could be at home or you are selling at the comfort of wherever you are. So karibu sana. As always, it's a pleasure to have you joining us, and importantly, interact with us. Hashtag Morning Cafe. Drop those comments. Let's get to see what questions you have for us or for the panel, and we'll get to answer them in regards to the issues that we'll be discussing and even much more. And also at Linda_Lela is my Twitter handle. At TV47, you can drop your comments there and we get to sample them as we proceed. For those who are streaming online, that is on Facebook, on TV47.co.ke, or on YouTube, you can as well drop those SMSs, or those messages. We'll be going through them as we proceed. So once again, I say karibu sana, and we kick off with the stories that have been prepared by my team. I'll be having Dr. Justice Juma joining me, so we can go through these stories together, and also the stories that are captured on the newspapers. So we start off on some bit of a sad note, as 41 staff members from the Pumwani Maternity Hospital have been confirmed to have contracted COVID-19 during his visit at the hospital earlier yesterday. Director General of Health, Dr. Patrick Amott, says that 19 of these, or those infected, are healthcare workers, and the remaining 22 are from the support staff team, as Zainab Mohammed has the details.
Just a day after Kenya National Union of Nurses announced that 15 nurses had contracted COVID-19 at the Pumwani Maternity Hospital, the government has come out to confirm those claims, saying the total number of infections at the hospital is now at 41 staff members, 19 being health workers and 22 support staff.
There's a remaining batch of about 100 staff members to be tested. Out of the 290 who are tested, 41 turned positive. All these 41 have been on home-based isolation. 2 actually have been discharged from home-based isolation care. And the remaining 39 are doing well. Nobody has gone to hospital for care. And we are hopeful that they'll be able to pull through without developing any symptoms of COVID.
In his visit at the hospital, Director General of Health Dr. Patrick Amott, however, said the hospital will not be shut down, but some of its services will be scaled down to contain the spread of the virus.
Generally, to see the measures that the hospital has put in place: 1, to stop further transmission of the infection, and 2, to support the healthcare workers who have been affected in one way or the other during this difficult period.
So this to assure the members of public that Pumwani is not closed, because the percentage of those who are positive was very low. But what we have done is we have scaled down the services.
The government is now appealing to health workers to follow the containment measures and guidelines to the letter in order to fully protect themselves from contracting the virus. This as the number of healthcare workers in the country who have contracted the virus rises to 450.
And my final appeal to healthcare workers is, don't leave anything to chance. Please implement to the letter the information that you get from the case management team, from the infection prevention control team, so that you're not only safe for yourself, but safe to serve another Kenyan who may unfortunately come up with COVID-19.
Amoth Father says 416 out of the 450 healthcare workers who have tested positive for COVID-19 do not have any underlying conditions, with 16 having hypertension, 6 with asthma, 3 with diabetes, and 5 with HIV and AIDS.
I think that could be working in our favor is, of course, our demographic profile. These are very young people. Out of these 450, 414 don't have any underlying problem. No wonder most of them are asymptomatic and they qualify for home-based care.
Elsewhere, the Kenya National Union of Nurses has come out to complain about the inadequacy of personal protective gears in most hospitals across the country, a matter they say is putting frontline healthcare workers at risk during this pandemic.
Personal protective equipment can only be seen to be there when they are protecting our workers, our members. But they cannot seem to be there because somebody in other house is shouting and taking tea of 4 million shillings in a day.
For TV47, I'm Zainab Mohammed.
And still on matters COVID-19, the country has recorded 497 new COVID-19 cases as of yesterday, pushing the numbers to 10,791. Meanwhile, the government says that 199 COVID-19 cases have already undergone intensive care unit management since March this year, as Mohammed Ali reports.
3 of the 12 Kenyans who succumbed to COVID-19 yesterday died at home, but not under home-based care, the government has said.
These are community deaths, but these are community deaths not from home-based care plans. We told you that for home-based care, we are using a very judicious and cautious approach to ensure that those who go for home-based care actually qualify for home-based care and will undergo home-based care throughout the 14-day period.
Meanwhile, the government says coronavirus is a systemic disease that can affect the heart, the kidney, and the blood system, and does not only cause chest problems.
New evidence is emerging from across the world that this disease is actually a systemic disease, a disease that has effects on your heart, a disease that has effects on your kidneys, a disease that has effects when it comes to the clotting of your blood and the coagulation of your blood.
The country has recorded 497 new cases, with Nairobi and Kiambu recording 292 and 62 cases respectively, as the numbers continue to rise.
The behavior by some of our people in different ways, exemplified in different ways. We've seen people taking pictures, recording videos of ambulances and vehicles ferrying patients. We've received several social media forwards of people, depicting COVID-19 as a cause of different events in the community. And worse still, we've seen people even sharing pictures and videos of COVID-19 patients. And this has ended up leading to profiling of the infected people. And it's important that we know that this is highly unacceptable.
Mohammed Ali, TV47.
And we take a look at the People Daily. Dr. Good morning.
Morning, Lina.
Yes, that's Dr. Justice Juma joining us this morning to expand some more on what has been captured on the newspapers and also the stories that we have. And I think we'll go with that very one, or the two that we've looked at, that is on COVID-19. And of course, the cases as registered as of yesterday, we have mentioned them. But there's this story that has been captured right here on the front page. It's actually the main story of the People Daily. And it's a cry for help as 429 medics are infected, and more or less a red flag, as health workers unions are now warning that crisis brought about by coronavirus pandemic is getting out of hand, and of course with chronic understanding and inadequate PPEs compounding the problem. Captured on page 6 or expounded on page 6, and also the numbers are captured right here in terms of what we had recorded as of yesterday, 479. And out of samples that were taken, that is 4,992 samples. And also captured on page 7, pre-existing conditions stock corona patients. I mean, it looks like the numbers are going up and up by the day, pretty much unfortunate, and all these occurrences. I mean, what do you make of them?
Well, it's a challenge that is manifesting the preparedness, especially how we equipped our medics, who in this case actually our forefront soldiers in fighting this war. And we did raise this a while ago, that the best way to defeat this thing is to put our best foot forward and invest in the appropriate areas. In the essential for health, normally it begins from the primary basic, and then secondary basic, and the tertiary level. And in the primary basic, this is where we focus on in the community. And then at the secondary level, this is where we focus on the isolation center, the medics, the health facilities. Then at the tertiary level, that is the critical level where we focus on the ICUs and the high dependency unit where units where we are taking care of serious patients. And in our case, the cry that the medics were crying out earlier was that they ought to have been equipped with proper PPEs. And the fact that they're getting infected is very questionable. And that actually is also alarming, alarming the entire nation, because if the doctors are that vulnerable, then how about citizens? Yeah. Because how well can we be prepared if the doctor themselves are not effectively prepared? So I think, yes, we need to review our approach, especially the Ministry of Health and the government entirely. And I urge the doctors to be more vigilant, and congratulations even to those who are fighting to a point of losing their life. It's so commendable. These are the heroes that we need to actually bring to light, because people who have literally laid down their life to fight this pandemic, those are serious Kenyans who actually needs to be congratulated, be commended, be supported. And I urge the government to do the best we can. If we cannot equip them, I remember police were outside there controlling people and they did not have proper PPEs. Now doctors again have been on the cry. So I think, yes, that cry needs to be heard. They need to be supported if we truly are to defeat this thing. Because the moment even the doctors become afraid, then definitely we will begin to lose the battle, and we cannot afford to lose this war at this stage that we've reached.
All right. Well, this comes amid the medics faulting the Ministry of Health on the proposed law, and the union leaders claim that proposed amendments to the current health laws amid a fledgling war against COVID-19, that the ministry has lost focus and the country should be prepared for the worst. And even as Mohamed Duba said, the proposal to remove professional associations from the councils amounts to gagging the voice of the health professional or the health professionals. And it's pretty much unfortunate. These are the numbers that we are talking about. And like it is, when it comes, it's from the horse's mouth. Those are the medics themselves saying that we should prepare ourselves for the worst. I think, there's cause for worry, and that is what we'll be discussing this morning. And we ask this question: should we prepare ourselves for a lockdown? And there are likelihoods that we're going to proceed to a lockdown. Of course, we're not trying to prophesy doom, but from the projections that we are having, it is pretty much unfortunate. Keep sending those messages, and we'll be looking at that as we proceed. Now, to a different story, Matatu operators have been forced to comply with the directives issued by the Ministry of Health by acquiring a certificate before resuming services. This comes a week after the cessation of movement in and out of Nairobi, Mombasa and Mandera counties was lifted, as Eli Lugova now reports.
Normalcy in the transport sector is yet to resume, a week after restriction of movement in and out of Nairobi, Mombasa and Mandera counties was lifted. For a few PSV companies that have complied to the Ministry of Health regulations, operations have not resumed normally, as only a few Kenyans are willing to travel.
We have a letter from the Ministry of Health, and we have a letter from the county government, so which we had to show. We had to fumigate our buses to ensure that they are free from the virus. That one we did when we were on the lockdown. So we have all those papers.
Among the guidelines to be observed include all PSVs to regulate number of passengers, to keep data of all passengers, ensure all vehicles and luggage are regularly fumigated, and ensuring all drivers are tested and certified. With the few people traveling, many of these companies have scaled down their operations by reducing the number of fleet operating daily. This means commuters will dig deeper into their pockets as the fares have been increased.
So we are hoping that we are going to operate smoothly, but as pertains what we were doing before the lockdown, we used to do like 30 departures per day, but right now we are doing like this morning, because of the curfew, we are doing only the morning hours. We are doing like 10 departures to various destinations.
Eli Logova, TV47, Nairobi.
All right, and with life slowly starting to get back to normalcy, domestic passenger flights are expected to resume as from today, and that is the 15th. The resumption comes after the government lifted the ban on air travel due to COVID-19, but it will not be business as usual as the reopening comes with strict measures. Our reporter Nancy Kimuyu gives us the details.
Airports in the country are acting in preparedness and are ready to resume services after a 4-month paralysis due to the COVID-19 pandemic. Kenya Airways has put up measures to help their clientele against catching the novel coronavirus. They intend to have at least one temperature check at the airport and frequent sanitizing of surfaces and touch points. The cabin crew will be in full PPE gear and will offer an enhanced on-board service. Those who enjoy taking meals in the plane will have a difficult time as no meals will be served on board. There will be different hand washing stations and passengers will be required to stand 1 meter apart as they wait to get their services. The airline also advises its passengers to play their part in mitigating the spread of COVID-19 by checking in online and wearing a face mask at all times at the airport and on board. It is the beginning of a long journey back to normalcy, with the hope that there will be an economical boost in the aviation industry and safe flights for passengers. Social distancing in the plane is still a twisted jargon for many airlines. Reporting for TV47, I'm Nancy Kimuyu.
And on matters of transport, there is a story that has been captured on the front page of the People Daily and expounded some more on page 2. And here we are on how much it's going to be tough and times ahead as the levy pushes up pump prices. And this story is also what will be forming a basis of the conversation this morning also. But let's just have Dr. weigh in on it. And according to people or the pundits, they say that the move puts to an end a price drop in the global markets as a result of a slump in demand caused by the coronavirus pandemic. So Kenyans will have to dig deeper into their pockets to buy fuel following, of course, the steep increased petroleum prices that were announced yesterday. In a monthly review, the Energy and Petroleum Regulatory Authority announced that the maximum pump prices for super petrol, diesel and kerosene in Nairobi had risen by 11.38 shillings, 17.30 and 2.98 per litre respectively. And Dr. it's just the other day that we had a review downwards, so to speak, but here again we have a review upwards. And now that we are talking about matters transport, which is key, we know that a majority of Kenyans highly depend on public transport, and already the prices are high courtesy of COVID-19. And when we see that the pump prices again go high, this would mean again there's more that they'll need to give out. Where does it place us and what does it mean, knowing that very well this is not just a problem in the country but indeed a global issue?
Actually, it's a huge hit on the citizen because it go against the expectation that the citizen needed to actually help them combat this menace. It's coming at a point when other governments. Like in our neighborhood, Uganda, you're aware that Uganda has hardly experienced COVID deaths.
Yeah.
Because of the measures that they put in place. Globally, the other states which have also gone ahead and provided better social reliefs, which actually have mitigated the pressure for citizens to not expose themselves in crowded areas, and also individually help in fighting these menace. And what the government needed to do at this moment was to look at this thing now and in future. Now and in future was, because the future calls for protection of the economy and protection of jobs. And for now, yes, we can fight it. Of course, we're not just fighting for bio-life, but we're also fighting for way of life. So how possible could we fight in a manner that we can sustain our way of life? We can also fight so that, we can also fight in a manner that we don't lose life, but provide also mitigative measures that sustain the economy. Currently, if you look at the status that our country is in, Kenya may experience a terrible, terrible economic depression that we've never experienced. And the concession measures, because the loss of the jobs that we experienced the last few months, Linda, is enormous.
Yeah.
And if we continue in this trajectory, then yes, we are going to continue seeing a major loss of life. You're going to continue to see more depression, more suicides. You've seen families breaking apart, and jobs are closing. And the measures that were required to help help sustain and protect jobs, one of them were actually to reduce the cost of production, which is directly affected, especially by fuel. Because globally, fuel right now is below $1. Why Kenya has refused to go downwards and review further downwards to bring that ease for, especially in the transport sector. These are individuals who have not been working. These are individuals whose revenues actually have been reduced. The number that they used to carry, now they are carrying less. So if you ask these individuals, again, to pay for extra charges, sometimes it amounts to like a daylight robbery. If you were to require them to help you fight the pandemic, I think the government should provide these licenses at no cost. They should not be charged again if indeed we need to make a sustainable impact. The transport sector should be actually the over and above tax holiday on matters that are affecting them, since they're already generating half the normal income. And remember, these guys are also on loans. However much they can negotiate loan holidays with the banks, but those periods will still be paid. So in one way or the other, they are paying those loans. These guys are paying expenses, they're paying rents, they're paying taxes, and they are still required again to go back into their pockets and pay for additional certificates. Even the hotels, why require them? Why ask them to pay more? Make this certification free and affordable, so that compliance can be easy in the spirit of protecting jobs. Because the further we lose more jobs, the worse our economic status. And with the terrible economic status, actually our competitiveness within the region or globally will be wanting, and that will expose the country again. Yes, Rina.
Okay, well, and we wait to see how that will play out. But indeed, like we said, pretty much an unfortunate occurrence. And now crossing over to the counties, and counties will use the second generation formula to share the 316.6 billion shillings in the 2020-2021 financial year. The disputed formula will take effect in the next financial year, but will be passed this Friday. Elizabeth Mutuku now reports.
which they had last year. The proposal was that we then suspend the implementation of this one by 1 year, so that what happens then is all the counties keep the money at the same level as they had last year for purposes of budgeting, and then now this new formula kicks in the year 2021.
In the proposed third-generation formula, 18 counties would have lost over 42 billion shillings. The second-generation formula, which was passed in the year 2012, was to serve for 3 financial years, with the current financial year being the last one. The formula saw a reduction on the basis for poverty index from 20% to 18%. And with the third-generation formula, Nandi County would have been the biggest gainer with an extra 1.2 billion shillings, while Mandera County would have been the biggest loser with about 2 billion shillings.
My problem was with members wanting to affect, or influence, emotions on people, that we are being targeted, we are marginalized, or we are this and that, which, now the population thinks that there is a scheme through a formula to marginalize anybody. So they're saying, okay, so which formula now will not marginalize you? You give us a formula, okay? Instead of just letting people sympathize out there. So what is the formula?
18 senators from the affected counties had vowed to oppose the proposed formula.
Simple argument is that if you come from a place that is sparsely populated, those people also require services, and they have to walk longer distances for them to reach services. So we want to reduce the amount of distance that they would move for them to get services.
Taita Taveta County, for example, would have lost at least 400 million shillings in the proposed formula.
Let's just go by the second generation formula up to and until that time when there are more resources, so that no county loses money. Counties have already done the budgets. Wamefanya budgets zao tayari. And they have done even their appropriation bills. Na zimepita tayari. How do you tell them now we'll give you 2 billion less?
The Senate is said to have a special sitting this week, which will see the formula pass. Elizabeth Matuku, TV47 Nairobi.
All right, and just to couple that with this story here, on the People Daily, page 13, counties inherited 57 billion debts from the defunct council's report. And this is according to CS Wamalwa, who says the state agency had identified 62,342 parcels of land, over 70,000 buildings, and 2,600 cars previously owned by the defunct civic authorities. This is according to Devolution Cabinet Secretary CS Eugene Wamalwa. Well, we talk about matters, corruption at the level of the county, and looking at the allocation of funds. There's been a stalemate for a while, but looks like they have found a truce that maybe would not augur well with some of the senators, but I guess they were forced to take a chill pill or a humble pie. But where does it place the counties? Remember, some of them argue that if you proceed to award the counties something that is insufficient, then you will certainly expect insufficient delivery at that point of the respective counties. Dr. Yamun, can you hear me?
Yes, I can hear you, Linda.
Yes.
Actually, I have always advised a member of parliament to think globally if they act locally. Because when you're looking at the revenue allocation, the formula that we're discussing actually is clearly spelled out in our Constitution, in Article 201 and Article 202, which was informed by the historical injustices. You remember the departure between the Jaramogi Oginga Odinga and Kenyatta, the founding president of Kenya, was on the basis of marginalization, where economic allocation was done on bias, especially tribal bias. And to date, those gaps have not been we've not filled those gaps. And if you also revisit the spirit of BBI, and to me, this is a clear message being sent to the other partners or the members of BBI team, whether they are really going to implement the BBI report or is something that is also going to land up in a shelf. And to me, this is a message that speaks a negative philosophy against nationalization and unity, and also addressing the past injustices. Because to date, even Linda, if I use simple example like national libraries, in Nairobi we may have national libraries, but visit other counties. You go to just even Kitui here, there's no even a library where people can step in to study. If you can visit the Presidential Delivery Unit website, look at the accomplished projects. Most of the projects, they are within specific geographical location. Just the other day, we questioned why a fish project can set its headquarters in Nyeri, not in Mombasa, and not in Kisumu, where the communities, the populace, the human resource are actually individuals who understand the fishing project. So this biased allocation of resources is what informed Equalization Fund and set out certain criteria that was to be used in revenue allocation. And the moment they're reverting it to one man, one vote, which is okay, that is something that we can discuss if there was equity. But the moment that we are not having equity, those who are talking about the population being more vis-a-vis the other geographical location with the minimum population, they are forgetting that those other population went down, they died, they suffered because of marginalization. And this is why our constitution took cognizance of affirmative action to help this geographical location to come to power. So I think the philosophy behind this new revenue allocation formula, it is taking us back into the dark days, and it is going to cause, because those were the things that led to perennial shed of blood due to tribes feeling that they're not well appreciated, they're not well taken care of, and others feel more special than the others. Those are the things that led to ethnic cleansing, and we needed to cure this. And instead of curing this, some people who are thinking locally, acting locally, very myopic in their understanding, because this is a force that is being pushed. And we questioned when the census reports were coming out. Some of us questioned the verifiability of the census report, because census are used to allocate revenue. And now we can see the intention of mine, and we suspect highly that some of the census were adopted to raise up certain population numbers in certain regions for purposes of this initiative that the intention that they are now pushing right now. And this is dangerous. If Kenya goes in this direction, Linda, I tell you, this is a part that we need to avoid. Whether they are trying to calculatively say that it will take effect in the next 1 year, this is something that is going to be reviewed. This is something that is going to remain contentious, and this is something that might not see the light of the day.
All right. Speaking of which, it looks like you're speaking in the same tone with the support with the ODM members and also, MPs or legislatures allied to Deputy President William Ruto, as captured on the Standard newspaper. And the biggest story say that Raila Ruto fight Uhuru Cash plan, the unlikely alliance, a new formula for sharing 316 billion among counties supported by the president, is facing a stiff resistance in the Senate from allies of Deputy President William Ruto and ODM leader Raila Odinga, as captured on page 10. We won't be going into details of the same, but then again, of course, as Kithiki Kindure, they are weighing in, and also Senator that is James Orengo, in regards to the same, who are not in agreement to this proposed aspect of sharing the revenue. We can only wait to see if this is done and dusted. Of course, we see to it whether it's going to do justice to some of these counties, as Liz Mutuku has taken us through the breakdown on who would have been the losers or who are the gainers on this particular one. And now moving on to a different story. National Assembly Majority Leader Amos Kimunya is today expected to table the changes in various House committees, replaced recently discharged William Ruto's allies, and former Majority Leader Aden Duale is the only Ruto ally who is likely to get a powerful House committee as a member of the Public Accounts Committee. Josh Ansari reports.
The changes in House committees are expected to be tabled in the National Assembly Wednesday. The changes will see Kangema MP Muturi Kigano takes up the chairmanship of the Justice and Legal Committee. Kigano takes over from William Cheptumo, who was discharged. ODM's Otiende Amolo will deputize Kigano, though the Orange Party wanted the chairmanship of the committee.
Let me be very clear, and I want to advise the President against allowing appointment of minority members of parliament into the positions that we who are in the majority lost. They were taken away. We are not satisfied about the reasons. There were no reasons given.
Kieni legislator Kanini Kega and defender of President Uhuru Kenyatta is expected to take over the budget committee from his Kikuyu counterpart Kimani Ichung'wa. Ichung'wa is among the 16 MPs who were discharged from House committees and has been moved to a less powerful committee of House Welfare. Former Majority Leader Aden Duale is expected to take up the membership in the powerful Public Accounts Committee in the National Assembly. Duale is the only MP among the Deputy President William Ruto's allies who has been given an influential docket. The reconstituted list, compiled by Majority Leader Amos Kimunya and Minority Leader John Mbadi, MPs Gladys Sholei, Moses Kuria and Benjamin Washiali, have been replaced in their previous committees. Gatondo South Member of Parliament Moses Kuria will be a member in the Implementation Committee, while Washiali will serve in the Broadcasting Committee, and Sholei is expected to be placed in the House Rules and Procedures Committee. ODM's Gladys Wanga and Florence Mutua will chair Finance and Education Committees respectively. Langata MP Nixon Korir and Joyce Koril will serve in the Member Service Committee. The Deputy President William Ruto's allies David Kosing and William Kisang are likely to survive the purge and retain their positions as Transport and ICT committees respectively. The two are said to have a good working relationship with Transport CS James Masharia and ICT CS Joe Musheru. Joash Onsare, TV47, Nairobi.
Well, coupling that report by Onsari and Uhuru allies now want Kusitani expelled over indiscipline. Move follows a demand by the Soy Member of Parliament that he be furnished with the Jubilee Party's book of account for last 4 years. And Caleb Kusitani is demanding for the Jubilee Party approved budget to financial year 2016, 2017, 2018, 2019, and 2019-2020. The MP is also asking for all approved procurement records, reports, and all committee minutes for the 5 financial year. He also wants the certified bank accounts of the party accounts. This is a move that has gotten him to that point where some of his members, or some of the members of the Jubilee Party that is allied to Kieleweke, argue that this is not a good move, and probably there needs to be a move of pushing him out of this. And I'll just loop in Daktari, now that you are a party leader, and a lot of confusion when it comes to sharing of revenue within the party, within coalitions. I mean, what always is the criteria, and who is supposed to be privy to the information on how accounts and monies are being used at the level of the county? Sorry, not the county, at the level of the party.
Exactly. I saw a response letter to that request by the Secretary General of Jubilee Party. And I think he just ended up calling his deputy secretary a Mongolian, and and stated that the reports are in the public domain. You can go in the website or visit ORPP's office or visit Office of Auditor General. But to weigh in on just the previous clip you ran on the alliance of the handshake between that actually has led to current changes on the departmental committees within the parliament, and the reviews which have now thrown away former majority leader and is rewarding him with another committee. It is a demotion either way, but I think also to the coalition partners or the handshake partners with the Jubilee Party, they seems to be worried a lot, because what they expected with the reward they expected from this reshuffle, it seems not to come out the way they expected them. Looks like they supported Uhuru before setting up certain demands. And in one way or the other it worked, because we saw Uhuru actually crossing over from his deputy, and you've seen the changes that he has been doing, the hard tackles. But when the coalition partners opted to start making demands, which currently I think looks like they've started discussing 2022, because I heard minority leader asking that they may allow Raila Odinga to run for one term, an indicator of 2022 discussion, which they've been avoiding all this while. And the moment they begin mentioning 2022, you've seen Uhuru actually, when they thought Uhuru was going to kick the ladder so that Uhuru hung on their side without falling back, then Uhuru has begun again playing and warming up to his deputy, which is quite a dangerous politics. They are playing with one another. Because looks like when they start laying demands on the table, Uhuru has chosen to play around. And this shows, and to me, is an indicator that the BBI expectation may not see the day and the light of the day if this relationship continues the way it's continuing. And as I told Kenyans earlier, sometimes treachery begets treachery. Love begets love. Tyranny begets tyranny. Kindness begets kindness. And Linda, this is what flows even in the relationship within the political parties. If you see lack of clarity where a deputy secretary general is questioning the secretary general and even the authenticity or the availability of party documents, it leaves you asking a number of questions, because there's no trust, there's no clarity, there's no transparency. And these are strange bedfellows who come together for purposes of their own selfish interest. And these are the things that actually have shifted their goalpost. So the alliances which you cannot count on, their formation of political parties are not driven by ideologies. And these are the issues that actually have made them to fall out very easily, because when you are driven by ideology, it is a vision that unites you, that a call for collective responsibility, because a vision cannot be achieved individually. And these are the challenges. When I sat back and supported the BBI report, because the BBI reports entirely had just two issues of governance, that is the premiership and the electoral reforms. But over and above, the other abstract issues that they were discussing, some were very good, because they are beginning to discuss the national narratives, national ethos, national visions. And the moment you start discussing the national visions, then all of us collectively begins to appreciate the significance of one another, and you start handling each other with love, with mercy, with care, with justice, not always this Machiavellian deceit, manipulation, conniving, stealing here, destroying there. It's the culture that everybody is investing, then I assure them that is what they will beget.
Yeah. And now, speaking of, taking care of us and just having a peaceful coexistence and minding about others, indeed, the government has been mindful enough to roll out the second phase of Kazim Mtaani initiative. And many youths across the country are still grappling with unemployment despite that. This amid the government promising to factor in 207,000 young persons for the 10 billion national hygiene program. This follows mass sackings that have affected many Kenyans since March, when COVID-19 first hit the country. David Muthoka brings us that report, and we come back to weigh in on the same.
Babadogo slums in Nairobi are literally an estate with a new face. The fresh start here, courtesy of the Kazim Mtaani initiative, is however nothing to smile about for the thousands of residents here who claim to have been left out of the program. The second phase of the National Hygiene Program that was launched by President Uhuru Kenyatta a week ago seeks to employ up to 270,000 youths, a significant upgrade from the previous 31,689. Amid the upgrade, tens of residents from Babadogo have criticized the criteria used in enrolling youth from the slums into the initiative. The criteria has seen them plunge into further despair, having not been selected to participate in the initiative that would have seen them earn 455 shillings a day. In Kariadudu Estate, we stumble upon Edith Akinyi, hobnobbing with her peers, having successfully applied for the second phase of Kazim Mtaani. The mother of one knew it was a matter of time before she bid her state of joblessness goodbye. To her shock, she still remains a statistic among those who never met the cutoff.
Sasa kama tunaenda huko, tunapelekwa huku, tuende Korokocho, siju tuende la Kisama tuangalie jina.
A few blocks ahead is Rose Anyango, a mother of two, another jobless corner here, seemingly gaining traction. She laments of not being among those chosen, despite applying for the now much sought after occupation.
Niliapply kazi, ile results zilikuja, nimeenda kufuatilia naambiwa hakuna.
The doom and gloom cuts across gender. And for Kevin Omondi, another resident, it is shocking not to know of anyone within their community who will benefit from Kazim Mtaani.
Tungependa sana kujua juu wenzetu wanakuwa nalia sana njaa, matumizi ya pesa hakuna. Though kuna pesa tunaambiwa ilikuja za Kazim Mtaani ya vijana.
And for those who are successfully selected, they are still unaware on when and where to report for duty.
Alichukua namba yangu ya simu, akachukua ID yangu, akaniambia niko kwa hiyo shift nyingine. Na siko sure kwa shift nyingine iko.
Grace Law, an assistant Nyumba Kumi leader here, has now been left with the hefty burden of explaining to the tens of her residents why not even a single person among the 61 she had forwarded their names was picked for Kazim Mtaani. Local administrators have, however, defended the selection, saying the initiative will carry out phasing in the enrollment to cater for as many applicants as possible. In Trans Nzoia County, youth from Saboti and Kiminini constituencies were among the 4,103 youth selected as Kazim Mtaani kicked off in the county on Tuesday. Youth from other sub-counties have, however, decried discrimination.
Tumeshangaa kazi jatupata sisi huku, si tuko tu hivi kuhangaika tu kwa puya kutembea tu.
For the many youth here who had the hope of giving back to the society, well, at a cost through the Kazim Mtaani initiative, that hope is now basically ink on a piece of paper tucked inside some cabinet. This, another classic case of so few slots for so many jobless people. David Muthoka, TV47 at Babadogo, Nairobi.
Thanks, Muthoka, for that. And looking at that story reminds us of the numerous programs, of course, under devolution or in matters NYS and so much so. So before we get to Lupio Daktari to react on the same, let's pick this story. And Kirinyaga MCAs have started to collect signatures from residents in a bid to dissolve the Governor Anne Waiguru-led administration. This comes days after the Senate dismissed an impeachment motion against the embattled governor.
Sisi kama MC wa Kirinyaga tumesema ya kwamba imetosha na tuwezi vumilia tena, na kwa hivyo kwa sababu gavana wetu sasa imefika mahali hasikizi mtu yoyote, hata afuati sheria kabisa. Sisi tunasema na kauli moja kama MC wa Kirinyaga, kufa dereva, kufa makanga.
Sisi hatuna shida na mtu, lakini tunataka hii county iwe dissolved, kwa sababu hata wakati tuko huku hakuna kazi inafanyika. Pesa tunapeana kwa budget, tunasema wandi sifanyiwe kazi. Kama kwangu hakuna kazi imefanywa for the last 2.5 years.
All right, that brings me to that story, and I think it's captured on the People Daily page too. Let's see whether we can have a hold of it. Yes, here we are. And the Kirinyaga MCAs now seek residents to nod to dissolve the county. Brings me also to the front page where there's this story of Charity Kaliku Ngilu, and Ngilu has the last laugh as accusers have vanished in thin air. Also captured on the front page of the Standard newspaper, and expounded some more on the People Daily page 8. Daktari, first to react on the Kazi Mtaani aspect and how it reminds us of the issues of NYS and how much of a scandal they were. Just how genuine is this Kazi Mtaani, and of how much impact will it be to the youths as it stands today? Briefly, as we cross over to the issues that are taking center stage in counties in terms of talks of impeachment of the leaders and the governors there.
Oh, it's one approach that the government is using right now to mitigate corona relief and the pressure that serious job losses have caused. Yeah. And last time I had an activity with PS who is in charge, that is Charles Hinga. Mm-hmm. And I remember I did ask him how the total population that they have supported or they have enrolled. I think it was about a month ago. And by then, naturally, they'd engaged 20,000 youth. And of course, Linda, you rather work and get some food, but any job also should come with the dignity and the status of whoever is doing it. I can't imagine a degree holder going to, with dignity, to sweep and cut the grass to get food. It is a suitable option. Of course, as you mentioned about NYS, we saw where it landed. But this one, when he mentioned that only 20,000 vis-a-vis a population of 47 million, who over 60%, actually 65% of it are youth, if you are only addressing 20,000 and looking at the total amount of money that actually have been actually they are saying to have spent, then yes, we can have a reason to be worried. We can have a reason to be concerned, and more our concern can be worse than even the NYS, because you cannot allocate billions and the return, because I said earlier that activity is not an accomplishment. We may see few activities of 20,000 youths.
All right.
And the amount of money that is alleged to be invested in them vis-a-vis what we expected. Because if I was to advise the government, the focus of the government was to find out mechanisms to make sure that no one loses their jobs. Yeah. Number one, maintain those jobs. Then if we were to talk of creating more, then it will make sense. But right now, the job losses have surpasses over 1 million plus.
Right.
If we are losing more than you are creating, and whatever you are creating actually is even just a drop in the ocean, and at a basic remittance, which actually cannot change anybody's life.
Right.
The policy the government should have focused on to date was to look at economic mitigative measures, have tax holidays, reduce fuel cost, go easy on the land rates,
right?
Give some incentives and boost, like now the tourism, the transport sectors, essentials areas of our economy, give them certain reliefs so that we focus on jobs that have integrity, not just these jobs that they're actually, this sweeping and cutting grass is not sustainable. It cannot run an economy.
All right, Daktari. And I think on that note, I'm afraid we might not be able to delve deep into understanding what has happened at the level of counties in terms of the talks of an impeachment. But as it is a relief for Ngilu after ward representatives stopped the Oster move. Some of them have gone MIA. Anyway, let's take a short break. And of course, we'll be back with the current affairs issues. Thank you so much, Dr. Justice Juma, for the great insights. After this break, we are back with more.
You're welcome.
tell me you're alright.
All right, welcome back to Morning Cafe. Time for the current affairs discussion, and we have lots of stuff to touch on. We can only hope the time would allow us to go through, amongst them, the controversial bill on reproductive matters that had been presented by Nakuru Senator Susan Kihika that has unveiled a lot of issues, and of course, carefully worded reproductive bill, so to mention or to name it, that is the 2019 reproductive health bill. And of course, also has raised another debate on matters of abortion, and lots of debates across, as people support it and others equally, say that it is not the right direction to take, depending on how they look at it. So we'll be looking at that briefly, and we get to weigh in on the same, of course, with the panel of the day. Betty Adera is joining me this now, the Secretary of Kanu Women Congress. Thank you so much for your time, joining us via Skype. Good morning, Betty. You're well?
I'm well. Thank you for having me here today.
All right, Karibu Sana. And we'll also have Lucian Ogano, who's seated right next to me on my right. Thank you so much for your time this morning.
Thank you.
And you speak of this with so much, interest. That is a controversial bill, so to speak, presented by Senator Susan Kihika. Why do you have so much interest on this particular bill, and why do you suppose that it has received love and hate in equal measures?
Thank you, Susan. Linda.
You're right. I know. I know. That's why I said you speak of it highly. Yeah.
Okay. Thank you for inviting me here.
Welcome.
Now, this reproductive health bill is a very controversial issue, which is touching on very grave matters that are of high public interest. Now, these are matters which involve reproductive health of girls and women, and from recent months and weeks, especially during this COVID-19 period, we have been able to see many instances where we are facing challenges with matters such as pregnancies, teenage pregnancies, which have been seen majorly in some of the counties which have been highly affected, such as Machakos. So this is a very controversial matter, and personally, I have been able to review the bill and study it, and I can comprehensively outline that this bill will seek to address issues on governance which include matters of safe motherhood, assisted reproduction, reproductive health on adolescents, and termination of pregnancies, among other matters.
All right.
Okay.
And let's try and loop in Betty. Of course, this is a matter of interest, and now that everyone is talking about this bill, and the first thing that comes is the safety of our girls, the safety of our mothers, the safety of our children. Betty, it is absurd how much, of course, one bill could be incorporating lots of issues that need to be addressed, but only one simple clause could get to that point whereby it gives the bill life or it denies it a life. I don't know whether you've been able to set your eye on this particular bill.
Yes, thank you, Linda. I have set my eyes on this bill. I've talked about it on a couple of platforms, also being a public health specialist, focusing on adolescent sexual reproductive health and rights by training. You correctly say, you're right to say that actually the bill in its entirety, and given that this is even the second time it's coming to the floor, it is not like every piece of it is bad, but one or two tomatoes in it, can spoil the entire tomatoes, in the basket. And I believe, as my fellow panelist is highlighting, this particular bill provides for access to family planning, provides for access to assisted reproduction. It provides for access to termination of pregnancy, and it also makes provisions around reproductive health and rights issues touching on our young people, the adolescents. So I believe that actually the controversies are around the fact that a section of Kenyans, and there are very loud voices from the religious sector, that in the Constitution, Article 26, Parts A, 1 and 2, provides for the right to life and holds that life actually begins, at conception. So there's a general feeling that this particular bill contravenes, that very basic right that we are provided for in the Constitution. Secondly, the other controversy comes around provision of age-appropriate, comprehensive, sexuality education to kids in schools or kids everywhere. And again, the belief here or the fear here is that that particular provision will be then introducing kids to issues around sexuality at an early age. It will open, when you talk about comprehensive, it may open up doors, to things such as contraception, abortion, and also introduce, gayism and lesbianism. So these are the fears, around it. And there's also a general feeling that this particular agenda is being pushed, forward by the civil society who have their own interests. But here is where I am. This particular issue touching on reproductive health, is as controversial as anything. Even if you go to Europe, you go to other parts of Africa, even in the Americas, this is a touchy issue, because then, except you bring everyone, into the same table to have honest conversations about it, then we are still going to have, chapter 1 and chapter 2, and this might fail, and maybe another time. And in the meantime, what it is happening? Our girls are getting pregnant, every single day. They are aborting backstreet even now as we are sitting, in this particular studio. We are currently having the big issue of teenage pregnancy that has also been catapulted to a further level due to COVID-19 pandemic. So for me, I think what needs to happen is, I would be happy to see a bill that is so comprehensive at actually strengthening prevention rather than curative, and get into the root cause. And one of the root causes is actually fighting poverty. I'm telling you, if you fight poverty the right way, we are going to find a situation that all these things will come down. Why would a girl, for instance, need to terminate a pregnancy, right? Because it's a pregnancy that is not wanted. And there are so many things that can go on around the fact that, around the process of her getting pregnant. Maybe she was sexually assaulted. Maybe, she traded, sex for something, sex for food, sex for pads. Sex for school fees, sex for this, that, and the other. And I'm thinking that this is not a time for blame game. This is not a time to point fingers, but this is a time, to open up the space for more comprehensive and very honest dialogue. Because I do not think there's anywhere in the world where a religious, institution will ever say that sex out of marriage is okay, all right? But on the other hand, any child that comes from such a union is again a blessing from God. So that's a paradox, right there. But can the church also come forward and say, this is what we are proposing on how to use our faith-based spaces, to coach and mentor our young people, both male and female, the right way, so that then they can wait, or they can, prevent all these issues that would come. And lastly, this particular bill is very silent on the rights part. Remember, it's sexual reproductive health and rights.
Right.
The rights have to come with it. The rights of non-discrimination, availability of services, access to services, quality, informed decision-making, privacy, participation, accountability, and all that. And we're beginning to see that reproductive health issues are actually being relegated to the back of the room, again, because priority now is what? Is fighting COVID, and COVID-19 might be here, for a while. So I believe that this is a time to go back to the drawing board. At least it is. I'm excited that now this bill came, and that there's an opportunity now to debate it. There's an opportunity to spark conversation, among Kenyans. And lastly, I would also just want to say that civil society is blamed for this, but civil society is not the enemy here. The enemy here is perhaps weak systems that are in place, that are failing, to protect girls, are failing to educate girls and boys on how to keep themselves safe, so that then we don't have to speak about abortion issues, except it is in the interest of the safety of the mother.
Right, pertinent issues being brought on board right there, Lucian. And yes, and of course, looking at what Betty brings on board, this bill, for some reasons, has started this honest nest due to the proportion perceived to legalize abortion, and also the talk of the fact that is in clause 26. That's the reason why maybe the churches have come out to go against this, because they're pro-life. But looking at the occurrences, I would want to argue that again, the bill has found itself up, or has surfaced up again, courtesy of course, the numerous numbers that we had of teenage pregnancies at this particular time of COVID-19, numbers that are still being registered. When you look at this clause, do you suppose then really, when it is presented as a polite way of saying that there is no value of life, or maybe there is indeed reason, as of course stipulated again on the particular bill, on why we should proceed and conduct abortion in the event that such occurrences play out?
Okay, my Mrs. Adera has talked of Article 26 of the Constitution of Kenya, and she has outlined Section 1 that gives every Kenyan a right to life. This also includes an infant at conception. Section 2 outlines that right to life begins at conception, because life starts at conception. Also, there is Section 4 of the article, which outlines, which explains the current state of abortion legally in Kenya. In Kenya, legally right now, abortion is illegal unless under circumstances outlined by Article 26, Section 4. Section 4 outlines that abortion may only be procured when the life of the mother is in danger, when the life or health of the mother is in danger, or when there is need for emergency treatment, or unless permitted by any other written law. Now, this article is what has been transferred to Section 26 of the Kihika Bill, Reproductive Health Care Bill. So, I am of the opinion that, okay, right now, we are in a time where we're facing COVID-19, which has also socially affected the general public. Implications have been that we've seen an increased number of teenage pregnancies, which you cannot ignore at this time. So, in my opinion, it is pertinent that experts work together with, religious leaders, together with legislators and other stakeholders to uphold this bill, because it does not necessarily seem to explain that life has no value. The bill actually, Section 26 of the bill, actually it realizes that Article 26 is part of the law of the country, and the Constitution ranks highest in the hierarchy of laws of Kenya. So it has comprehensively covered this article and does not seek to explain that life has no value. Life has value as from conception.
But what are the prospects of this bill sailing through now that these arguments are here, and there's some sects that actually support it, and there are others that are opposed to it, especially, of course, now that you're talking about the religious sect, which is key also in most of the decisions that are made in the country, especially when it revolves around the interests of the people.
Yeah, religious leaders are major stakeholders on such matters. The Kenya Christian Association, for example, is against the bill, citing little consultation in its formulation. The Kenyan Conference of Catholic Bishops is against the bill, citing that provisions of the bill are against our African cultural background and it is against our general faith. Atheists in Kenya is a society, and they are supporting the bill, saying that it has best interests for women in the country, women and girls. Now, these are opposing views, whereas there are also other views from different stakeholders, including women themselves. So I don't really think that, okay, I'm not in support of what the KCCB and the KCA are outlining. You know, these authorities are led by very august leaders, and we cannot purport to ignore their views. Their views are actually very sensible, and they have raised very genuine concerns. But however, there are other factors that we need to consider.
Factors like?
Factors like, these are matters we are facing right now. That women and girls are the ones who stand to suffer if this bill does not wave through. Mrs. Adera raised that this is not the first time the bill is on the table. It was also in the table back in 2014, where it failed to sail through because of factors such as minimum public awareness. There was little public and political apathy, as well as political will to sail the bill through. The Kenyan Conference of Catholic Bishops expressed its views by sending a letter to Catholic MPs. Now, MPs and legislators are also major stakeholders who will ultimately determine whether the bill sails through. So, in considering all these things, I think that we can. Okay, Susan Kihika, the Honorable Susan Kihika, is a legislator. She is well placed to support and finance this bill. So it is also okay that there is a lot of differences on people's views on this bill. It is not yet law. It is only a bill. Of course, there is the procedure where a law is made from a bill, where there is the first reading, the second reading, the committee stage, report stage, and the third reading, presidential assent. This bill has not yet gone through all these procedures, and therefore is not law.
And speaking of which, I want to ask Betty Adera, as we drop on this particular issue, there are processes for it to go through in the event that it is supposed to become law, or it is supposed to sail through. Looking at its prospects as it stands, do you suppose then if it sails through, it's going to be for the advantage of the girls out there, or the advantage, of course, of general reproductive health in the country? And what prospects or what changes do you suppose should be made for us to see a scenario where, again, this bill would be able to sail through, or adjustments?
Thank you. Well, any bill that goes through has an advantage not only for the people who propagate it, but an advantage for everyone in the country, especially the women and the girls. Now, if this bill particularly goes through, then I want to believe that we are going to begin to see more responsibility and accountability on provision of sexual reproductive health and rights, especially at county level, because remember, health is a devolved function. So we would need to see, more funds allocated for this particular purpose, so that to give the bill meaning in the event, that it is passed. Now, I want to believe that for me, I'd wish to see a narrative that goes like this. Instead of saying, we are going to shoot it down, we're going to wait it, we're going to shoot it down, we're going to bring it down, I would really, really advise and urge my fellow Kenyans who are not for this particular bill to say like this, to rewrite their narrative and say, hey, there's a bill that's coming up, but we want to be part of it. We want to be part of that conversation. Can you pause it for a while? Can you bring it back, to us? Can you incorporate us into this conversation so that at the end of the day, a bill that is, presented to the president for approval is one that has voices from all stakeholders, including the girls and the boys themselves. Remember, we also had very controversial bills before that have passed, like the family bill. There's also the Sexual Offences Act. So this was super controversial, but they had to go through the same process, of the National Assembly. There was enough dialogue for so long, but at the end of the day, when they were passed, everyone from religious sector to private sector to communities to civil society to just regular men and women were saying, okay, so that is really a bill that speaks to us, and then we want to support it. So for me, I want to just say that, look, this is what we stand to lose if we do not pay closer attention to this particular. This is what we stand to lose if we don't pay attention to this particular bill, especially when it touches on our young people, the young girls and the young boys. One, the teenage pregnancies are actually going to increase. And remember, when a pregnancy is coming in, there's also chances that HIV infection and infections from other sexually transmitted diseases is also coming in. So it is like a double-barrel challenge for the particular girl. That every pregnancy, there's also the risk of obstetric complications, because these are girls who are still children, who are still growing, they're still immature, to carry a baby to term successfully. We also risk, continuing to see the unsafe abortions that are happening backstreet, will continue to be on the rise, and we will continue to have a huge number of bed occupancy in the maternity wings of our public hospitals because of complications from that. Now, with the COVID-19 pandemic, I do not know when they will eventually open schools. Will our girls be in schools? Will our girls go back to schools? So that's something that we really also need to think about. And if our girls are not going to school, then in the long term effects, what does that mean to families? What does that mean to them themselves? What does that mean, to us as a people, and also, to government? We will be seeing more, stigma, rejection at community and family level, leading to mental health issues, and of course, just propagating, the poverty that will continue, to become cyclic while we're really trying to fight poverty. So this is something really we need to be sober. This is one of those bills that we need to approach with sobriety and tease out the areas that are controversial and them aside and say this is good, let it be. But 1, 2, 3 is not sitting well with us. But what can we do about this? Of course, informed by reliable data or evidence. But people just need to come back to the drawing table and propose solutions to this particular problem. And then not only target girls and women, bring also boys and men into this conversation, because no pregnancy will ever happen except a boy or a man comes in between the legs of a girl or of a woman.
All right, as we drop that one and we cross over to matters COVID-19, well, of course, it also equally involves the COVID-19 menace that we're facing. And the numbers are on the rise by the day. So we're shooting up and shooting up and shooting up. What does it speak? What do you make of this? Doesn't it scare you? And if it does scare you, what should we do? What is this strategy that is different that we probably need to incorporate as a nation to address it?
Yeah, yesterday we were looking at 497 new cases, which were as at yesterday only. Now, COVID-19 clearly is getting worse, every single day. Now, the president is in himself at a very tough position because as he considers what measures to, to maintain and which measures to drop, he has a very tough debate between lives and livelihood, where easing restrictions is a threat to life, whereas putting in so many restrictions is a threat to livelihood. Many Kenyans, especially those who are less privileged socially, have decried, tough times economically. They don't have things to do, especially at the time when we were having the 7 p.m. curfew, as opposed to right now when we have the 9 p.m. curfew. So it's getting worse. It's affecting especially Kenyans who are of a low social status in life. And the lives versus livelihood debate is something that continues to be one of the very key factors that the president should look at in addressing restrictions, whether to ease restrictions on COVID-19 or whether to tighten these restrictions.
All right, Betty, coming to you, and yes, the numbers are high. I know you've spoken about this over and over again, but I think for as long as it's here with us, we are left with no choice but to ponder and just discuss it as much as we can to see to it whether we are able to get a truce or just to figure out how best we can deal with COVID-19 as a country. I mean, President Uhuru Kenyatta proceeding to lift the cessation of movements on the hotspots, proceeding to ease restrictions in a way. And the argument on ground is we put up restrictions when we registered the first case. And now we are easing restrictions at this point when we have high cases standing at 10,000 moving forward. I mean, even worse is that this is not changing, or the curve is not going down, the curve is shooting up. Where does it place us? What does this mean? I mean, should we again prepare or brace ourselves for a total lockdown?
I think you're right to say, Linda, that COVID-19 should be a topic every single day. In fact, if you could just be putting aside even 5 minutes, just to talk about it, because it's here with us and it's yet to get murky and ugly. But now, looking at COVID-19 even globally, from a global platform, this is a virus that took everybody, by surprise. It is a storm, that came, and it is a storm that has shaken systems, even the systems that we thought were strongest, in this world, right from economies and even health systems. We have seen how even countries with very, very advanced healthcare systems, have had people succumbing to this particular virus, in very high numbers, daily. So Kenya is not an exception. And I want to believe that while we still need to do more, Kenya is not yet, the worst case scenario, if even in Africa. Now, at the beginning of this pandemic, not much was known. Not much was known about it in terms of what is it, where is it coming from, how is it, spread from one person to another, but even more importantly, how do you prevent it and how do you manage those who have already been infected? And we saw the entire world, struggling with this, everyone paying a close ear to what the WHO, was saying and their advisories every single day. So while we see that the country was locked down when we only had less than 10 cases, I think that was the right decision to do at that time, and perhaps that is what has even caused us not to be as bad as other countries that we have seen, in the media. But as head of state, I wouldn't even want to be in his position, insofar as COVID-19, is concerned. Right. We needed to first of all strengthen our health systems, strengthen our response mechanism, strengthen, county level response to the pandemic before, we could open up the country. So there's that balance of the disease on one hand in terms of progression, but then there's also the other balance of, the economics. The same us were pressurizing the president to open up the country. People are going hungry, people need to travel up country, and all that. But I want to believe that in his wisdom, of course, advice from his, health experts. He did what he could, as head of state. Now, the fact that the disease is actually progressing is not strange, it's not new. It is within, the modeling that was provided by the health department in Kenya.
Yeah.
And remember, they are still projecting that August, September, is when we could get to the peak, to the peak of it, to the worst case scenario, from Kenyan front before we can begin to see, the flattening of the curve. So the storm is not over. The storm is actually, still coming. But again, as everybody, has said, from the head of state to all leaders, the health experts, to you in the media, this disease is not going to be fought by the president. This disease is not going to be fought by the Ministry of Health. This disease is going to be fought by you and me, following strictly the provisions that have been put, the social distancing, the hand washing or sanitizing, the wearing of the masks, everywhere, avoiding gathering if you can avoid it, avoid it. And of course, the minute you start feeling sick, taking action around that. If you come in from somewhere, self-quarantine strictly, like for 14 days. If you are ill and not, the level of being admitted in hospital, now they have brought, provisions for how you can isolate yourself and what you need to do, in your own house. They are opening up, churches in a phased manner. We already beginning to see the provisions that have been made, although the religious sector is also up in arms, with that. But my point is, it's going to take you and me, the regular Kenyan, to take, the provisions very, very seriously and keep ourselves safe. There is no way this virus is ever going to be flattened by a third party or by someone else, but it will be flattened just by you and me. Now, the fact that the numbers are increasing is actually not strange. We've even seen countries, even Wuhan in China itself, they opened up the economy, they opened up schools, but what happened? They had to close. They had to close again. Close by to us here in Madagascar, they had opened up the country, things were just going on okay, but then there was an upsurge, of new infections, with very dangerous, projections. What did they do? They had to close, the economy again. So even in Kenya, in the next presidential address, I would not be surprised if the president says, hey, I let you guys to move around freely, but now this disease, you're not following the advisory, and I'm shutting down the country again. Right. If it's to get to that, so be it.
All right, and of course, speaking of which, picking up from where Betty has left, and Lucian, you realize that we know very well the catalyst of the spread, or what triggers the spread even more. And she's mentioned the key measures and the provisions that have been placed on the table for us, but we still do not abide by them. Looking at such a scenario, and she says very well that if the president gets to that point where he says that, okay, well, I'm afraid we have to go back to where we were simply because we have not been able to deal with this as expected. Why is it that we find it so hard to go by what is expected of us in terms of upholding the measures and not floating the rules that have been set aboard by the Ministry of Health?
What you're asking is indeed true, that there has been relaxation in adherence to these measures. For example, social distancing has drastically reduced, and measures such as having a mask on, sanitization, and all those other measures have been seen to reduce. Now, even in public spaces, even as we watch on TV, these public spaces that are big threats on COVID-19 breeding places, it has been observed that there has been a great relaxation on the same. And so, in my opinion, we stand to Dr. Amoth yesterday warned that we might be on the verge of climbing towards the peak of the pandemic, which is in actual sense true. Because now we are at around 10,000 cases, which may get worse by August, as he had warned. Now, it is sensible to reason that as the pandemic gets worse, people are also getting, tired, and they're also getting less strict with adherence to the measures which have been put in place. And therefore, as Betty Adera has outlined, it is solely on us. The president is trying to do his part. The Ministry of Health, through, of course, Dr. Amot, the Director General, CAS Mercy Mwangangi, and the entire team are doing what is in their power to help us. It is also our duty to do what is in our power, where our power holds the biggest share. It is also part of our duty to do what is in our power to help them achieve the intended purpose.
And we know very well of the dangers that lie ahead of us, Betty. World Health Organization now warning that nations are heading in the wrong direction, and they say that the coronavirus pandemic will get worse and worse if governments fail to take more decisive action. The World Health Organization has said that, this, of course, courtesy of what is happening across the world. I know as governments try to grapple on whether to save the economy, save the people, get the people out of poverty, deal with the issues that have emancipated courtesy of COVID-19. And, the other time, the argument was that President Uhuru Kenyatta went ahead to ease the restrictions because of the pressure that was coming from the people. I mean, at this particular point, is it a point for a president or a nation to succumb to the pressure that comes along with the effects of COVID-19, or to remain firm and deal with this? Look at the fuel prices today. They continue to soar. They continue to shoot up. And of course, OPEC says that it's not going to get any better. Where does it place us? And why should we, at least isn't this, knowing very well that the end goal will not be achieved?
You're very right, Linda, to say that. And to that, what I can just say is, look, there's a very delicate balance between, saving the economy and saving the people. And if you ask me, of course, right to life, supersedes all other rights. But at the end of the day, when a woman in the slums is sleeping hungry with her children, and her children are almost dying, because of hunger, then are we not trying to prevent death, regardless of how it comes? And I think, like the capital city, Nairobi, and Mombasa, that were the epicenters, of COVID-19 in Kenya, actually had a super stretched, healthcare systems, with more and more people coming in. The ICU beds, even in private hospitals, were all full, and there was now an even bigger challenge of what to do with people who are very sick, who are coming and queuing, and there's no bed even. But remember, even before the president opened up, the country for free movement within the country, there had been a lot of pressure and plans for county governments to up their game in terms of preparedness, at least minimum 300 beds, within at the county level, to help, cushion the pressures that are happening at the national level. Remember, healthcare is a devolved function, but COVID-19 is a special case that has to be led, by the Ministry of Health at the national level. So I want to believe that part of the wisdom was, if we open up this country for 21 days or 30 days, and then let's allow people who have always wanted to travel up country to go, those who have always wanted to come to Nairobi, to Mombasa, to come. That way, those who then may be sick beyond that particular announcement would have the opportunity to be handled, at the county level, rather than overstretching, the healthcare system within the city. Now, the government also needed to try and see whether are Kenyans abiding? Will this virus actually, upsurge? Will it go down? And one way of testing that was, let's open up the country, let's allow free movement, let people just be, but of course, within a certain limitation of following the provisions. And then we see, and like I said before, this has happened in other countries as well. So at the end of this particular period, was it 21 days that was put, that was set? If the data evidence will be showing that we are actually moving into a very dangerous, dangerous position, then, the president would have the latitude, to even bring on board, more stringent measures. But remember, government, yes, about punishing anyone. The curfews, and the restrictions is not to punish anyone. And in some cases, that is how it is being viewed. But it is to protect you. It is protective, and it is the government's full mandate, to protect its citizens. But again, whether the virus goes down or it gets into its peak in September, in August, September, it boils down to you and me. I think we cannot say enough about how important it is to put on masks, not on your chin, cover your face, put on the mask the right way, sanitize, wash your hands, as much as you can. Practice social distancing, even if you're in your business area or in a public place or whatever. These are things that now cannot be negotiable. While some Kenyans say, this thing is just porojo, it's just propaganda, it's just, this, that, and the other. Me, I don't know anyone, but we know real people who have actually lost their lives. These are not evidence. These are real human beings with names, with families, who have lost them. So I think it's incumbent upon us as Kenyans not to be complacent, about this particular issue and take it very, very seriously. Remember, right now the virus has now gone everywhere, even in rural areas where there are our shoshos, our old grandparents. The virus is now with them. So we are more enlightened. We also need to take the responsibility to educate, the less enlightened, at home in the villages, so that at the end of the day, we see a flattening of the curve. Everyone is so desperate to get back to the normal, but except we take it up upon ourselves, we are not going to get there. And lastly, I also just want to urge our government to continue cushioning the women, the men, the youth, in this difficult time. This is actually not a time you want to see, prices of fuel going up, because when fuel goes up, even a matchstick price, is going to go up. Yeah. And the person who's going to suffer most, who's going to bear this brunt most, is that person who's already so stretched, from an economic perspective due to COVID-19.
All right, and of course, as we talk of matters COVID-19 in the country, because it's Wednesday, most of our Wednesdays are dedicated to discuss issues revolving around COVID-19 and all these reports that are coming on board. We're standing at 10,000 plus cases in the country. Still, we find time to politic. As we always say, politics, runs every activity in the country. Politics, in a way, stands, a huge, of course, ground in terms of deciding on what fate or what direction most of the issues in the country are going to take, including COVID-19 issue that is taking a center stage as it stands right now. As we politic, Betty, let me come to you and touch a bit on the events of politics in the country. We know very well that we've had a series of issues at the side of Mlembe Nation, a series of issues in the Ukumbani region, a series of issues within, of course, different respective parties, the key parties for that matter, ODM, talking about Jubilee Party, and the numerous factions that crop up within the Jubilee Party. And this is evident and clear based on what we saw yesterday in regards to the awarding of course, of committees to different figures within the Jubilee Party and within, of course, the House. And this is subject to, of course, approval as of today, and being gazetted and also being, of course, mentioned officially as of today. And it looks like the DP is losing and losing by the day. What informs this now that Kanu reaped big and you probably are now enjoying the fruits of it?
Well, we in Kanu are excited. Ndani ya serikali.
Ndani zaidi.
Ndani.
I hope it's a good move. I hope it's not a dangerous move. I hope nobody is going to be compromised in this.
Look, Kanu never makes a mistake, on such things. Remember, even in 2017, they're among the parties that, of course, were friendly to Jubilee, were supportive of Jubilee, but did not dissolve.
Yes.
All right. And there's specific reasons about that. And now that we are on it, I think I want to again thank His Excellency the President for allowing Kanu, led by our chairman, Senator Gideon Moi, into government to help him, achieve, his vision and leave a strong legacy in the 2 years or so that is left of this particular term. Now, coming to the issue of the Deputy President, here's what I'll say. There's a heavy price, Linda, to pay for disloyalty in a political sense. And this is not new. We have seen people right from, the time of President Kenyatta, President Moi, President Kibaki, and now President Uhuru Kenyatta, where disloyalty is not tolerated. Disloyalty can never be tolerated in a political sense. And if you have someone who's coming in with you as your partner saying, hey, we have a mandate to Kenyans. Kenyans have given us the duty, to walk in there and serve them for 5 years. And then after the end of the 5 years, something else, will come. And you're seeing one of your partners starting to look like they're already, running ahead of you. They're not with you in your vision. They're not with you, in your agenda, and they're pursuing their own, selfish interests. And they're starting to look like they're campaigning too early. Then that's a problem, because then it sets Kenya on an almost constant, campaigning, politicking, mode. And of course, we recognize the fact that even the last election of 2017, had its enough share of drama. So that is one. Another part is, again, when you come in, to an agreement, it's like a marriage. Once you get that partnership going, there's nothing like saying, these are my people, these are your people. Like, these are my children, these are your children. It doesn't work that way. All these people are for both of you, so that you move forward. You move the country forward, or the agenda that you set, rolling. I am super excited that His Excellency, the President, saw this, in good time, and he listened, to his advisors, and he brought a very big broom, that started sweeping, and that broom is not done, Linda. That broom is not done
just yet.
Yes, we have seen shakeups, in both houses. We are beginning to see, shakeups in other departments within the executive. And that is not going to stop, and I hope it doesn't stop. But
just how effective will this shake-up be? We're talking about a very short period for President Uhuru Kenyatta, if at all he has to attain any legacy, and if at all we're not going to go for a referendum. So just how much of effect will the purge be?
With good leadership, Linda, leadership is core, and leadership is everything. With good leadership and the right kind of environment, you actually do not even need 5 years to prove a point.
Okay.
Even just here, you can make a significant move for the betterment of Kenyans who actually put you there. Now, secondly, I wanted to talk about like the purge in the House committees. We are beginning to see that the BBI bill, it's coming, it's on the way. It's a very, very big one, not only for the president and his coalition partners, but also for the former prime minister, Raila Odinga, and his side, of his team. And even the issue that this is a good thing, for Kenyans. So if this is going to come in as a bill, bills are only debated where? In the House.
Right.
So there needed to be, a clear team, to receive this bill and debate it. And of course, we know who's for it, who's not for it, who has been supportive of it from its inception. And we also know the side, that has fought it. So for me, I'm thinking that it is a crucial moment for this bill to be, successfully debated, in the House and moved forward into the next step. And this is actually what Kenyans are really waiting for. You're right. Time is not our friend with that particular process, referendum or no referendum, we still, do not know. But I think doing the right thing, it is never too late. It is never too late, to do the right thing.
Well said.
Yes. Thirdly, we've seen, the last few days, drama between the Secretary General of Jubilee and the deputy.
The Tanga squad.
The Tanga squad. And for me, I had that once they moved to Jubilee Asili, it's like, whew, good riddance. The drama is over. But apparently the drama has not even started. It has not even begun. And to me, this is worrying, because then it will continue to put us, in that particular, in that constant politicking mode. While we need to be seeing, strengthening of Jubilee Party, the President Uhuru's side. Now that even we in KANU are in there, this is the time we want to settle. This is the time we want to say, with the short-term time left, this is what we want to contribute to the legacy, of the president. So for me, my point is, you cannot have your cake and eat it. You took your choice. It is within your constitutional right, to make a choice. But the minute you made that choice, move and just, stay on the lane that you.
All right. Thank you so much, Betty Adera, the Secretary, the Kanu Women Congress. That is Nairobi, for the great insights. We delve not much into matters policies because it's Wednesday, and like I said, it's more of a COVID-19 day. So we will wind it up at that as we cross over to a different segment altogether. Thank you so much once again, Betty and Lucian Ogano, for the great insights also on the previous issues that we've touched on. We cross over to this other issue of course, understanding COVID-19 and how best we deal with it at this particular time that the cases of, mental health, instability are on the rise across the globe. How best can we deal with this is what we'll be discussing next. And later on also, we take a look at how best you can make the best of your business at this time of COVID-19. After this break, we're back. And welcome back to Morning Cafe. Towards the last laps, as we get to discuss the lifestyle issues, the social issues, it's pretty much important that we have such conversations, especially at this time of COVID-19. And we have reports across the globe that mental health issues are cropping up, and the numbers are rising by the day. So today we have a mindset specialist who's going to take us through a session, a simple session of how best you can stay put at this particular time, how best you tune your mindset, and then it will come in handy to help you overcome the tough times that come along with COVID-19. So yes, we are all about mental health awareness and how best to deal with it at this time of COVID-19. Pastor Johan, who's the chief advisor of Kesha, joins me this morning to expound some more on this particular subject. Good morning, Pastor.
Good morning.
You well?
Yes.
Good to have you.
Thank you.
And straight to it, mental health cases are on the rise in the country and across the globe, something that is cause for concern. We call it a shadow pandemic in its sense, because yes, we have the main pandemic that we are dealing with, but we overlook the shadow pandemic that is underneath the issues that crop up, amidst the tough times of a family setup, social issues and all that. How best can we ensure that as a people, we are able to deal with this shadow pandemic so that it does not become trouble for us much as the COVID-19 is?
Yes, I believe that the kind of mindset and the mental health is also very important, especially in this time like this. Though there may be difficulties, if we have a good mental health, this is something that we are more than able to overcome and go over it. A long time ago, there was this one famous newspaper company in England, and they gave a question on the newspaper saying, if you get this right, then we'll give you a return ticket to some country for our journey. And that question was, what is the fastest way for you to travel from Manchester to London? And then many people gave an idea, traveling by bus, traveling by airplane, traveling by train, and you fly like a Superman. And somebody gave this answer, and that answer was chosen as the best answer. And that answer was to travel someone with whom you love. So when you travel with somebody that you love, then even 5 hours is too short. So 1 hour is also too short. And so why is it like that? Because when you travel with someone where you can share your heart and have your heart flowing, and then even 1 year and 5 years is also too short.
It's very short.
Yes. In the same way, in such a pandemic situation like this, we believe that having our heart continuously flowing is a very important thing, especially with your husband and wife and with your children and with your family members, because I think that's the best that you can really reach out to in such a time like this. And many times I see that the families in this pandemic, when they stay at home and they're busy with their mobile phones and busy with their laptops, busy with other works. But if we continue in that way, because you can't share your heart with these smartphone gadgets, but you are able to flow your heart and also share your idea and also share your difficulties with your family members.
I'll say this, majority of people will tell you that yes, in as much as that is what the family setup would want, they find it easier to focus on your gadgets as opposed to engage, because when you engage, there are lots of fights that will crop up. And also when we talk about just ensuring that you're in the best mental state, it becomes hard because it's beyond us based on the issues that come on board. So how do you get to strike that balance and ensure that yes, you can have a conversation with your family without having to fight, and also you can have the best mental state or mindset amid all the struggles that come are automatic and beyond you?
Yes, actually that's why this mindset education is very important, because mindset education is the education training that teaches you how you understand about this world of the heart and how this mindset world actually works. But right now, when you look at our basic education and the university education, there is no subject that teaches you how this world of the mindset is working. So people, they think they know it, but they don't know about it. 1 + 1 is 2. It's very easy. Why? Because we were taught at one point.
Yes.
But although it's very easy, if you're not taught, we don't know how to use it. We don't know how to go about it. In the same way, our heart is also the same thing. It's very simple and very easy thing, but because we don't know how to use this world of the heart and the mind, and that's why we also get into fights as we come into conversations and differences as well. And that's why having the conversation, understanding the world of the heart and the world of the mind education is, I think, is also very important.
But just how then do we get to that point of understanding the world of the heart, and get to that point of understanding the world of, the mindset and, the world of the mind? I mean, it is rocket science. I would say it's just exactly what you said. It's 1 + 1, but if it's not taught to you, then you have no idea.
It is very true. Many people also find that very difficult because when they meet and when they reveal their heart and when they start talking, they only find themselves fighting and arguing. And so that's why right now we are also organizing this mind education curriculum also into the basic education and also into the university curriculum. We are trying for that right now. And that's why we need to learn about it. Actually, in this short period of time, I cannot cover that whole curriculum. And that's why understanding about our heart and the mind is very important. And if I were to give a small taste of that, is that when we have a conversation, and now we need to have a conversation believing that I can also be wrong. Many people, they all think, I'm right, I'm correct. And when you look at yourself, you only want to look at, my eyes are pretty and my ears are pretty. You only want to see a good part of it. But also, I don't always have a good part of myself. I also have a wrong aspect of myself. So in one of the curriculum, we teach that I'm a person who can also always be wrong. If I approach and have a conversation with husband and wife and the children with the belief and knowing that I can also be wrong, and then I can't only criticize about that person's mistake. You can also make that mistake. It's okay. You can understand them and also receive their mistake as well. That's how now when you come into a conversation can also flow in a healthy and a profitable way as well.
So in this case then, what's important first is that aspect of people opening up. For instance, right now, you realize that most of the people have chosen to die by themselves. They keep stuff to themselves. They do not speak out. How much of an undoing is that, and how much can it come in handy to cause mental health instability?
As actually, when you also look at our body, I'm a pastor, I always look at things from the Bible perspective. So when I look at it, God, He had made everything to flow. If it doesn't flow, everything dies. For example, there's a Dead Sea. That sea is a dead sea because it only receives but it doesn't flow out. And also the air. When you go to any room that does not have a window, and there are many people in it, what happens? It smells a lot. Yes, the air dies and the water dies. And also our body is like that too. Our body can become very healthy in a natural way when our blood is able to flow very well. And so in Chinese medicine, there's an acupuncture, whereby acupuncture does the work of opening up the flow of the blood. So in the same way, when our heart is able to flow, and then that is the time and that our heart and our mental status also can be bright and healthy as well. Yes.
All right, very hard. It sounds very easy, by the way, when you were explaining it, but I'll tell you for free. And I'm sure every other person out there will tell you it's not the easiest thing to go out there and sit and confide and speak about your issues. And because then you're looking at the other person and you're thinking they also have their fair share of issues. So how do you get to that point where you can accept that it's important to share, that it's important to let it flow? Because when it flows out and some thought flows in, then it becomes healthy and healthier for you.
Yes, that's why I consider eating very important. Yes, I don't know whether you like eating or not.
I love.
But you don't really look like you like eating.
I don't know. Sadly enough, food does not do me justice, but yes.
I like eating actually very well, and because when you eat, now you can start talking about as you eat small things little by little. And I also like sports and I like exercising, because as you exercise, you can also come close from your body a little by little and also to your heart. And so you may not be able to have that kind of serious conversation at once and reveal it also at once. But if in a family organization, and now you start talking about things, don't try to open it up at once, but little by little, your heart comes close together. And especially also with my wife, I believe that to express, hey, honey, I love you. Wow, today, honey, you look pretty. And,
even when you don't mean it?
I mean, you mean it. You mean it. But sometimes, especially men, it's not easy for them to say thank you or sorry. But I believe that is also expressing your heart. And as small as saying, sorry, how are you? Good morning. And how have you been? And I love you. And I believe that those things are also a very important and small, simple way of also expressing yourself. And then because I love eating, and I find myself, expressing myself also very easily as I take tea, as I eating something, and just freestyle.
We should have brought coffee here.
Oh yes, I love coffee.
Next time we'll make sure that we do that. Yeah.
Thank you. Yeah. So just making that atmosphere also so that people can ease up their hearts and also to speak about it little by little.
It helps. Yeah, we are looking at a scenario of how best we can deal with this. But remember, we have a problem here at hand as it stands. So how do we first of all get to solve this particular issue as we look at how best we can incorporate some of these mindset programs in the curriculum and all that? Amidst COVID-19, of course, the environment is not conducive enough for us to open up, for us to have to chart the way forward and everything. But the problem is here. All the same, we have to face it. Right. So how do we run away from that scenario, from the numerous numbers that we have of mental health issues as it stands right now?
Yes, as you one thing that have that kind of conversation, one thing that you can feel is that your heart and your mind and your mental status is getting healthy. And when your mental status is getting healthy, before you are only looking at the depressive aspect kind of situation and that you are in right now. But when your mind and when your mental state is healthy, you are able to see the brighter side of that situation.
Right.
And so when you look in the book of Numbers, and there are 12 spies, and these 12 spies that they went to spy out the land of Canaan. And the 10 spies came out crying, saying, truly that land was the land that was flowing with milk and honey. And there are giants over there. It is impossible for us to go and get that land. There are so many inhabitants, and it is just impossible for us to go there. We can't defeat them. But now there were also 2 other spies whose mindset was different about it, whose mindset was very positive about it. No, there are giants, but because God has given us the promise, we are more than able to overcome it. And so later on of the story, God, he says, I am going to do according to what you say. So I want to ask the audience today, what do you say about this situation? So those people who has the strong and healthy mindset, and they look upon this situation and they can also say that, yeah, there are difficulties, but what is the way that we can change these difficulties into positivity? How can we take this pandemic into an opportunity? Yes, so those are people who has that healthy mindset, they are able to see this situation in that way. But those who have the weak mindset, they will only try to see it in a negative way. Oh, I don't have a job, and I'm difficult, we don't have a food. And if you only think about it in a negative way, your heart also continuously falls into the negative way, and so forth in a deeper and deeper and deeper way.
But just how possible, I think I'll ask this because, I mean, it's the best way to get to have the answers. How possible is it for the thoughts, these positive thoughts, to overcome the realities on ground, the situation on ground, the fact that I am jobless today, the fact that I have COVID-19, the fact that, yes, my children are just about to go and sleep hungry. How do we have this positive thought coming to whitewash that? And, you get into the other side of the bridge where there's so much positivity and hope.
Yes, there are those people who are only talking about that.
Yes.
How can I do it? How can I go to the positive side? It is because they have never experienced that world.
Yeah.
Yes. Only those who think about in a negative way, they only say how, and they don't actually make it into an action.
Yeah.
Make it into an action. Listen to me and do it. Step forward. Believe that there is an opportunity. Let me make this into an opportunity, and if you step forward, then there is always a way. Even me, myself, in my life, there are many pandemic kind of situation, not only in terms of this coronavirus, but there are also many pandemics.
Yeah.
Pandemics in my family. There's also another pandemic in my workplace.
Yeah.
But there's one thing that I believe. No matter what kind of pandemic situation it may be, there is always a way. That's why I always search out for that way. But when you go out with that mindset and search for it, yes, there are more rejection and then receiving you.
Yeah.
But because I believe that there is always a way, that becomes a momentum and strength in my heart for me to also go out every day as well. Yes.
Just how easy has it been for, say, you to try and instigate and incorporate this, first of all, of course, at the leadership level of the country? Because then if we're talking of a scenario where we're going to incorporate this, say, in the education system, of course, there are processes and procedures to it. How positive are you that this is going to sail through, and how much effort has been put towards achieving this?
Actually, I think it is already working.
Right.
His Excellency the President, in his speech, and so far last year and this year, he has spoken about the mindset about 3-4 times.
Yeah.
Even very recently, on that speech, I cannot remember that day, but that speech where he uplifted the lockdown, on that speech,
yes, it's on
in that
6th.
speech, he spoke about the mindset.
All right.
How we need to change our mindset about this kind of situation.
Yeah.
Yes. And many people are thinking that this coronavirus and pandemic is only bad. No, we can also turn this into an opportunity. And actually, difficulty is not all that bad. And I believe that difficulty is also needed in our life, because the difficulties also makes our mind and our health, our mental health also to become strong. For example, the children are growing up without catching cold at all in their life. When their body becomes bigger and bigger, then they are going to become weak. Why? Because they don't have any immunity inside of their body. But like even me myself, it's been now 11 years since I came to Kenya. And in the first 2 years, I think I was caught with malaria like 2 times, 3 times, because I went to Migori, Kisumu, and I travel all around. And so, but now, after first 2 years, I've never caught malaria. I'm still moving around, and I never had malaria. So I have that immunity in my body. So in the same way, malaria is not always bad. I believe that malaria is a very good experience. I'm sorry if there's any audience who has a difficult situation, but I don't see really difficulties as a bad thing. It makes our body also to become strong in the same way. It makes our mental health and our mind also to become stronger and stronger. And so later on, when you face that situation, you can also easily go over that situation as well. If I were to give you a short story, in Argentina, there was a very famous rugby team. And so it happened, I think it was in 1970s. And this rugby team was going to Chile by airplane to do a match. But on the way, their airplane crashed and crashed on the Chile mountain, Andes mountain. And then it was very high peak of the mountain, and it was very cold. The temperature during that time was going down to -20 to -25 degrees Celsius, and that is like about 10 times colder than your freezer at home. And so they had to survive, and rescuers could not come, and everything was covered by snow. So they all thought that they died. But they survived there for more than 70 days. How did they do that? They had a lot of difficulties over there. And as they were going through a lot of difficulties, they survived and they came back down. And after they came back down, after quite some years later, some of them became CEO. All of them, they became, these survivors, they all became successful people. And then the reason why they became a successful people is because now nothing else in the when they came back down, nothing was difficult.
It was difficult for
them. For their life.
Yeah.
They thought that no matter what kind of difficulties that they have faced, one thing that they knew was these difficulties is easier than the difficulties I have experienced in the Andes Mountain.
And speaking of which then, is there anything wrong is it wrong to fear? Is it wrong to worry? Is it wrong to stress about the difficulties that you're going through? Is there anything wrong about that? Even if you are soldiering on and hoping that things will change?
I mean, the fear comes. Yes, the fear comes. Even me, when I face a new situation, another fear comes and another burden comes.
Yeah.
But you know how to go over it now. You know that this is not only going to stay as a fear and the worries.
Right.
Yes, and then because that's how much your heart and your mental status and your mind has already matured and grown. That's what it is proving.
And as we get to wind up, are there any programs that are set towards, ensuring that people, or maybe just getting people to understand the importance of, having a proper mindset and the importance of having a positive mind towards the difficulties, towards even the good things that come your way?
Yes, right now we have. Right now, I'm a chairman of IYF, International Youth Fellowship.
Yeah.
I do many works, and one of them is Youth Development Project.
Right.
And Kenya being dominant by the youth population right now, and we are working for youth, and especially I'm focusing on developing the mindsets of the young people and the youth. And so starting from the 30th of this month, 30th, 31st, and 1st, for 3 days, we have this mindset training for youth.
This is virtually, I would want to believe.
Yes, and it's online.
Oh, all right.
And actually 94 countries are gathering together for this event.
Okay.
And I hope youth can take this opportunity. It's free, and take this opportunity to come online, register, participate in that event, and also mix up with other youth from different parts of the world. And not only that, also learn the mindset training as well. And if they log into IYF Kenya Facebook, then they can get a link on Google Form to register for this event, and also for upcoming events for mindset training as well. And one thing that I really also want to advise as a pastor is that when you receive the heart of Jesus Christ, Jesus Christ, He is the Word.
Yeah.
And this earth was without form and void, and darkness was on the face of the deep. And when God said, "Let there be light," there was light,
right.
and darkness goes away. And so I really ask the audience and to study the Bible and read the Word of God,
right.
and think about Jesus. And then I believe that, and that light which comes inside of their heart is going to chase away the fear and worries and the darkness from their heart.
Wow, amazing. Pastor Johan Kim, thank you so much for the great insights. And I hope you take advantage of that, because maybe it will come in handy to help you at these particular tough times. I mean, like we all say, we all have our fair share of troubles, but we soldier on and we choose to look at the right side and the positive side of life. And of course, on that very note, we say that yes, amid all these tough times of mental health issues, we soldier on, because then there's always light at the end of the tunnel. We'll cross over to a different conversation altogether as we bid Pastor Johan goodbye. Thank you so much for the great insights once again. Looking forward to have more sessions as we discuss the world of the mind and the world of the heart. Yes, of course, we cross over. After this short break, we'll be right back with Matters Business. Yes, and on the last lapse of Morning Cafe, of course, we're back with Martha's business. It's very important that you know how best you can make the best of your business at this time of COVID-19. I mean, everyone out here, left, right, and center, complaining that times are tough. But you know, you can always choose to look at the positive side. And I think we've just had that conversation on how best you switch your mind into positive thinking. And we have a specialist on board. I call her an award-winning entrepreneur. That is Hodan Mohammed. She's the CEO of Dodillion. Of course, to take us through this moment on how best you can make your best of the best of your business at this time of COVID-19. Hodan, good morning.
Good morning.
Thank you so much for your time.
Thank you for having me here
today.
today.
And of course, when we look at you, we're thinking, oh, now opportunities and how best we can make the best of everything. I mean, getting to the top 40 and the 40 is incredible.
Absolutely.
How did it feel like? Or how was the experience? It was good.
It was
extremely good. By now you should be used to, you know, all these winning moments and all that.
Absolutely.
And that's the reason why we termed you as the best person to discuss this. I mean, we are at that phase of COVID-19. Yes. Economy is tough. Businesses are on the verge of, you know, the worst moments. What do you make of this? How has it been for you?
Well, it has been tough as for everyone else, but I love the conversation that you were having previously.
Yeah.
Everything comes down to the mindset. We can get into a fear and get shut down.
Yeah.
Or do we look at the opportunities that comes out of chaos? So my goal was to venture into understanding what is the problem.
Yeah.
And each problem has an opportunity inside. And that's where
you came in, of course, and bounced back in terms of a business. So,
absolutely.
When you look at the state of the economy, of course, I don't even need to ask you. It is terribly bad. But you can choose to have a positive mindset. But then again, everything else around you drags you down.
Absolutely.
How have you dealt with this? How best do you get to that point where you overlook the difficulties that come along, you know, with the tough times of the economy and still stay afloat in business?
Absolutely. Well, that's a very good question, by the way. And let me just say this, that even the ones that are looking that they're doing really good went through the same process as everyone else is going through. And the shock has been for all of us. I was having several projects, everything cancelled, and you know what to do. And that's when you do that mind shift and start analyzing where the market is shifting, what really is happening, where we are heading toward. And adjusting yourself and reinventing is the key to the success. And that's when the new, you know, successful entrepreneurs born from the situation like this. Because if you look at any problems, you have to ask yourself, how can I best solve the problem that the economy is going through right now, especially the market we are in, the region we are in, and the industry we are in, and what is happening around that. If we look at previously, people could have nice to have things, but right now, nice to have things does not an option at all. So it's not existing. So the question now to be asked as an entrepreneur, as a business owner is, okay, what is the necessary? What is the most important right now for my clients that I should position? And where are they? Where is they are hanging out right now? Obviously, they are not in any events and definitely not in any conferences.
They're online.
Yes.
All right. So speaking of that adjustment, moving from, you know, the usual physical aspect of business, the usual home delivery aspect of business, the usual different approach of having sessions and meetings with your clients, and boom, they have been translated to that direction of online. How do you get there?
That's a very good question. And I love that question because right now, the biggest question that everyone is having, okay, so I used to get my customers from a cafe meetings, from gatherings, for different clubs, some, you know, let's say in different big conferences or summits. But now how can I be in front of them when they are not there? Now, this is what I'm teaching to my people, to my clients. at this point of time, the same model that it used to be happening offline,
right,
it's right now happening online. So you have such incredible platforms available to you, just waiting for you to rescue them from the danger they are, the chaos they are going through, the stress they're going through, the frustration they're going through. How can you look into that and rescue them? And talking about platforms, I'm talking about this giant, incredible platform like Facebook, like LinkedIn, like Instagram, like Twitter. They are literally having such incredible people that are really looking for your solution.
Well, it's not just open, but one would be strategic, or you would be required to be strategic, because I agree. Yes, it's such a huge cake for everyone to share. Absolutely. But then you find that it just doesn't work the way you expect it to work. Of course, in most cases, it will be in favor of others and, not in favor of you. So then one would want to ask, what are the strategies of penetrating the online market that are at our disposal as of now?
Absolutely. So that is really, really relevant, because everyone now, it's never been easier to start a business and run it online. But the biggest problem is the chaotic and the noisy, because that means the competition is huge. So how do you stand out? The new currency, the new valuable currency is an attention. So how do you grab attention?
Yes.
That is the key question to ask. Because before, advertisement was in front of you everywhere you go. You were having in billboards, you were having in your newspaper, you were having a flyer someone is giving you on the road. And it's always in front of you. TV, it's like you couldn't pass by, you could able to go and see them on the shop. But right now, can you do the same? No. People now have the choice when they are going on those platforms to spend time looking at their friends, looking at the family, looking at what's happening in entertainment.
News and entertainment,
Yeah, so they don't have time to look at your ads.
Advertisement, okay.
So the key question is, how do you grab that attention? And that's where it comes extremely key to strategize properly with your content that you're creating. Because at the end of the day, people are asking questions when they come to the internet. Internet is a hub for questioning. So your goal as an entrepreneur, as a business owner, is to answer those questions. So these are the key questions that people are asking, and we call that keywords. Based on that keywords, that creates the contents that you build for your audience. And based on that, you can basically grow. And through that, you can actually start utilizing the platforms that they are spending in. So as I was saying, as we are in the platforms as events, so similar situations happening on the social media and internet. So you're having groups, and these groups have its own topics, their own niche. They are talking in specific, let's say, technology. They're discussing around technology, around that. So now you need to go in that group and listen, hear what they are saying, and what are the questions they're asking. What is the next technology I should use? So how is the financials heading? Where I should invest? So those are the typical questions in certain industry are asking, correct? So if you are an expert or you are providing solution to that particular group, so you need to be in front of them and listen what are they asking, and pick those questions and position your product around that. Create the content. We said content is a king in the social media industry.
Wait a minute. I am just looking at the scenario, and this has happened to me, where you probably are looking to sell something, and this is your product. Then you go online and you find that there are people who are almost doing the same thing or are doing the same thing, and they are steps ahead, way ahead from you, of you. And there's always that aspect of how do I match up. Sometimes there's something that tells you, just give up, because honestly, you have a long, long way to go. So how do you get from that platform where, yes, people are discussing or are speaking the same tone as you, to a point whereby you're going to position yourself and stand out, or actually give reason to a client to look at your product and, sample them amidst or amongst the numerous ones that are in the market?
Wonderful. I just love that question, because we all go through that when we get into the first time on online space, because when you go there and you see those influencers that are ahead of you, you are seeing such incredible people, businesses ahead of you, and you're like, okay, how am I going to compete against such a people? And I mean, they're having such a big followers. Now, this is where I come back and say, it has nothing to do how big followers you have. It has nothing to do how many likes you have, how many impressions you do have. It's all about how consistently are you there supporting them. How much value do you give to this your audience? And another thing I always say, it works in offline very nicely. You can clatter, you can talk about X or B or C. But when you're going in online, it's more personal. It's more connecting to that particular person. So the more you can go niching, the more it's key for your product to stand out. And you as a brand to stand out, to be known for something. But if you are in all over the place and doing everything and anything, you're talking to no one. So the goal here, the first key, is to niching down and understanding that particular clients of yours, what is that product solving for them, and talking directly as a one-on-one, because at the end of the day, to capture someone's attention is a psychology, so how do you capture is talking to them as they talking to themselves. So understanding how are they talking to themselves makes your product stand out, your services to stand out. Being consistently standing there, sharing those burning questions they consistently asking themselves, and you having that solution to answer them, taking them from I don't know you and who are you to oh my God, you're my hero, and you really rescue me from going down on the drain. So that is the secret to actually growing your reach. And right now, it's never been easier to go global with such an internet and technology that we have in.
I agree. Well, and one would argue that maybe we are focused much on business owners, someone who started up something. What of the people who are in the employment industry, or they are employed in a way? They are probably employed to sell a product on behalf of the company, on behalf of their entity or institution and all that. So, and how do we get these people from that mind of saying that, you need to focus on employment forever and switch to that point whereby you can actually be running your own business?
Well, I have been there. I gone through that process.
From employment to how was it? How was it? Take us through that briefly.
I mean, it has been an amazing journey. Of course, it had its own
bumps and
figuring out, but at the end of the day, is coming down to the mindset as well, because we've been always taught to be an employee, not an entrepreneur, and not to own and be your own boss. Has never been taught us. We have been always taught to do. This is the formula. This is how you go about, and this is what I'm expecting you to give it and deliver. So when we are going employment state, what we enter is in, okay, is the information I have, but no one is really expecting from me that much. As long as I show up in my job, I'm good to go, and I do my KPIs, I'm okay. But the new norm, I mean, I was hearing this was a new term for me, the fourth industry revolution is happening right now, and I was like, that's interesting. Because
I want to be part of the fourth revolution,
Exactly, because right now where we're heading toward is not about what you know, is what can you deliver. What is the result that you can give. As an employee, you have so much options. I know there's a lot of people, and so sadly, a lot of people being laid off, hugely unemployed, it's going to the roof, not only Kenya, but across the whole world. And yes, government is going through a lot of effort to trying to figure out how to solve that problem. But at the end of the day, it's you who can solve your own problem. No one can come and rescue you if you don't rescue yourself first. So the goal here is that there's so much talent inside in Kenya that the world needs. And there are so much they could do on the online space. One naming is virtual assistant. So you have a talent how to manage X thing or Y thing. Like let's say you are an amazing of CEO assistant. You're a planner, you're organizer. Someone who's an entrepreneur online needs that support. You might be a launch manager, so you can actually support someone online how they can organize their launch to take the product out there. So there's so much they could do to manage their virtual assistant and provide that services. Another way is that actually taking their learnings, their experience that they have gone through, and perhaps package it in a way that it's a learning, and they teach how they have gone through from not knowing to actually knowing and taking a company and supporting, and they can actually create a content around that, because there are people that asking themselves, how do I do my marketing, or how do I sell my product, or how do I do my financial, or how do I do, XYZ. So there's so many questions people consistently asking. How do I sell virtually? I have never done it. I'm sitting in home. I used to work in the office, but now I don't know how to work.
Where to begin.
And where to begin and where to start from. So this is exactly the opportunities that might be available for people. But now the big question is, how do you shift your mind from being a victim to actually opening up your mind and looking into the opportunities that are lying in front of you, that you can grab the hanging fruits.
Right, amazing. And speaking of which, then we always say, like, it's good to have case studies, and it's always good to have testimonials when you're talking to the people, because then they can easily relate. Briefly, just briefly, what is this that you do online that gets you speaking so dearly about this transformation or this adjustment?
So if I ask, if I understand your questions, like,
okay, tell us something about what it is that you do. Say, something small.
Yes. So what I do is basically I help entrepreneurs to grow their, get more clients from an online space and really position themselves on the online space and grow their reach and get into access to the other markets, and basically empowering them through mindset as well. And as well, I help transition employees to entrepreneurs.
Yes. All right. Someone said that you have a very interesting story of employment, your employment journey. How about you give us something small so we know that, hey, well, this is how you got from employment and you decided that, boom, I need to do it my way. I need to learn how to do it my own way, and I need to employ others as well and feel the sweetness of being an employer.
Yeah. Well, my journey is it's very interesting. So I actually was I was working for corporate world for a very long time. I've taken them to the 40 countries across 3 continents, Europe, Middle East, and Africa. I fell in love with Kenya. I fell in love with being here, and basically what happened is that I was hired to come here in Kenya to help Oracle go into Horn of Africa, and it was the most challenging market ever. But we gone through and we explored and we managed the whole market to get into the next level. So when I achieved that, I was like really, really happy. But then that fulfillment wasn't there. It's like, what's next? And then it created unconsciously trigger questions for me, where it was like, okay, so hold on, is that all? What have you actually done? I started questioning myself. What if I left this world? What do I live with? Who would remember me, and what would they remember me for? And how many lives have I actually touched, and what is the legacy I'm leaving behind? So those were the biggest question that triggered, and I was in Diani, I was like reflecting upon it.
Yes.
And that was the day I made the decision and said, you know what, I think I'm not going to be able to help if I'm just working with one company. I need to see what is that my own calling. And I actually start venturing into looking at my mindset. And I went to psychology, studying life coaching, NLP, so figuring out who I am and where I'm standing for and what is my purpose, and trying to figure out me. It took me a little bit while, like about a year, to figuring out what I really want to do, what is my calling, because the questions started and kicking in me that, okay, employment is not the way I want to head it.
And speaking of time, some people are grappling with that, and they're asking themselves, you know what, probably I'm too old for this. Is there a time where you can say that you're too old to do something that you'd prefer doing, or the ground is always open for you to venture and swim and prosper?
I actually was having that question with one of my clients, and they literally are 17 years old and ask me a question like, am I too young?
Yes,
am I too young?
I think I'd ask the same thing, For a moment I'm thinking, yes, you are too young.
Am I too young to get into venturing an entrepreneur world? Never, it's never too young. I mean, what was his name? Wallman. He started 12 years old to do the investment and buying and selling, companies. 12 years old.
Yes.
So, I mean, if you look in the US, the biggest millionaires right now are under age.
Yes.
Now we say, okay, yes, we see a lot of young people, but then if you look at KFC, he started 60 years old.
Yeah. And it's doing very well across the world.
And he's doing like amazingly.
Yeah.
He went from not having anything, and he didn't know how to take his, chicken to, his food to the next, and he made it to a level where across the whole world.
And we enjoy.
They're enjoying. So there's no time. The question is, do you get that instinct, that intuition question comes in your mind? Is it the time
to do this? Wow. And I think on that note, we wind it up. I think it's food for thought for everyone back at home, whoever is watching us today. It is about you. Changing that mindset, changing that, negativity that you have. And for a moment, just follow what your instincts tell you. It's probably the right thing to do. And maybe once you make that bold step, you will never look back. Again, thank you so much, Rodan Mohammed, for the great insights and for your time. And of course, we keep having these conversations, as we say, there's so much space out here for you to grow. So why don't you go out there and grow? My name is Linda Alela. Great having you right from 6 a.m. up until 9 a.m. See you again tomorrow, same time, same place. Do enjoy the rest of your viewing. Bye-bye.
World of M-Truck Solutions, your trusted provider for bulk SMSs. We all